Hi, my name is Alexis, and I'm going to be talking about the condition of asthma. So, a little bit of background on asthma. Asthma is a chronic lung disease that inflames and narrows the airways. That happens inside the lungs. And so, people who have asthma who have inflamed airways that narrow and cause less air to flow into the lungs. Usually, these airways are constricted or they're filled with mucus, making it very difficult for these individuals to breathe. So some stats on asthma. About 1 in 12 adults have asthma in the US, which adds up to about 25 million people, which is actually a lot of people. About 1 in 10 children in the US have asthma. And in adults, women are more likely actually than men to have asthma, but in children, it's vice versa. Boys are actually more likely than girls to have asthma. So the cause of asthma is actually idiopathic. We don't actually know what causes asthma, but we do have a few ideas. So some of these could be due to a combination of environmental and genetic factors. So there are some triggers of asthma, so things like pollen, dust, or pet dander, respiratory infections, physical activity and cold air, stress and strong emotions, some medications, and also GERD are actually all triggers of asthma and can lead to this condition. So some risk factors associated with asthma would be if a blood relative or sibling has asthma. You could also get it possibly if your parents or anybody really in your family that has asthma, you could potentially have it as well. Allergies, a lot of asthma attacks or asthma conditions are actually caused by allergies. If you're overweight, if you smoke or experience secondhand smoking, also exposure to exhaust fumes or pollution, and then also exposure to chemicals. So people like hairdressers, farmers, and manufacturers that handle a lot of chemicals can actually end up having asthma. So some signs and symptoms of asthma, they actually vary from person to person. They're going to be different across the board, but some common symptoms are like shortness of breath, chest tightness or pain, as well as trouble sleeping caused by the shortness of breath or coughing or wheezing, the wheezing sound when exhaling, and then coughing or wheezing attacks that are worsened by a virus such as a cold or a flu, and then also difficulty breathing. So there are a couple different types of asthma. One of them is actually exercise-induced. So this happens when an individual is exercising, sometimes even lightly, and they have difficulty breathing and the asthma worsens. This can also happen when there's extreme cold air or extreme dry air as well. There's also occupational asthma, which we talked about a little bit before, which can be triggered by workplace irritants, such as manufacturers who work with fumes, hairdressers who work with very strong hair products and chemicals, and then also farmers who work with chemicals that have to do with like pesticides or anything that's helping their farm grow. There's also allergy-induced, which is actually probably the most common type of asthma. It comes from airborne substances such as pollen or pet dander, and it can increase the symptoms that you have with asthma. So when you diagnose asthma, it can basically just be done clinically. So by a physical exam, just hearing the breathing sounds, you could have them do an exercise activity that would be able to show whether or not their asthma worsens with, exercise-induced activities. You can also do a pulmonary function test, which would be followed by spirometry and peak flow. You can do allergy testing as well, or you can do a methylcholine challenge as well as a nitric oxide test. The methylcholine challenge and the nitric oxide test are actually not commonly used, but they are methods in which to diagnose asthma. You can also do an X-ray or a CT to see how open or closed the airways are, if there's mucus in them or not. Or you can also do provocative testing like an exercise test where you have the patient do an exercise on, let's say, like a treadmill, and you see how their lungs and breathing react to the exercise. So treatment for asthma, there is no cure for asthma, but the medications are basically triggered towards keeping symptoms under control. And so preventing asthma attacks is a huge thing. There are certain medications you can take. So one is a bronchodilator, or also called an inhaler, which many people use for asthma. You can also use corticosteroids, beta agonists, and also allergy medications. And those are my resources. Thank you.